My name's Danny. I specialize in manual lymphatic drainage, and I want to show you guys 3 spots where I always see stagnant lymphatic fluid on my clients. This first area, I don't hear too many practitioners mentioning too often, but it's right under the chin. I get so much stagnant lymph out of my client's face by clearing this lower aspect of the face. You need to drain this area anyways before you move up to the eyes and forehead. So spend a little bit more time on the lower jaw. You'd be surprised by how much fluid is actually pooling and trapped under this area. And if you look at my little skull here, you have some sinus exit points here, under the eye here next to the nasal area, and then above each eyebrow. So those are kind of like these 3 points here. And I want you to try to find these. They're like little divots on the bottom aspect of your chin. You should be able to find them even if you have a little bit more fat tissue there. So kind of spend a little bit of time like pressing into that area, and then you can get underneath this jawbone. I'm already swallowing. You're gonna press up and pull back. So we're just stretching the skin just enough to move the tissue. It is lighter than you would think, trust me. Or you can go press up and pull back. If I'm working on a client, I'm like this and pulling back. But spend more time on the lower jaw. A lot of stagnant lymph fluid will get clogged here, so make sure you're opening that area up so you get the best results. The second place I find a lot of stagnation on my clientele, especially anyone who has had a lumpectomy, a mastectomy, any type of lymph node removal, or even a break in the arm bone, a lot of that stagnation is going to pool in the armpit. This armpit will drain this whole arm, the back aspect, the chest area, and around the breast. All of this lymph wants to go up into this armpit. So if you're someone who's under a high amount of stress, operating in fight or flight, you are most likely chest breathing, and that's going to constrict all of these vessels in your upper area up here where your lungs sit. And if you're only breathing into your lungs through the upper chest, you're putting stress on these top 2 ribs. These expand outward to help you get more air into your lungs, but they're also part of your neck muscles. So you're gonna have constant tension on your neck, which is putting tension on the vagus nerve, which is keeping you in fight or flight, which is keeping you in that chest breathing area. So part of giving you out of fight or flight is obviously reducing your stress, releasing tension on the vagus nerve, which is in this aspect of the ear and neck area, and then focusing on belly breathing, but really taking the tension out of this tissue so the lymph can flow freely and properly drain so you don't have upper congestion, heaviness, that little jiggly part we get, all of us, like even if I have muscle, my arm still jiggles. This is where a lot of our lymph lives. And if we don't take the tension out of these cluster of lymph nodes in our armpits, we can't drain any of this. A lot of the lymph is going to live in this bottom jiggly part of the arm. And you really need to make sure you're taking the tension out of the armpit and the upper chest so this lymph fluid can flow smoothly. The final place of lymph stagnation that I find on almost every client, especially those who have been through trauma or are under chronic stress and stuck in fight or flight, is the diaphragm. Now, the diaphragm is going to relate to a lot of functions in the body. One of them being the liver function. The liver is kind of suspended by 4 different ligaments that sit right under this diaphragm, right under this rib cage. So if there's tension on the diaphragm, you're stressing the liver out. The liver is a huge role in the body. It does hundreds of different functions, especially part of your lymphatic waste removal system. So we want to take the tension out of the diaphragm. You can do this multiple ways. One of the biggest recommendations I can make is focusing on your breath and breathing into your rib cage, your side body, your back, doing a 360-degree breath, not breathing in and trying to push your stomach out like you're full or trying to make yourself look pregnant, but fully deep breathing into the pelvic floor. You are igniting these deep lymphatic ducts in the gut that drain the entire abdomen, back, and lower body. So taking the tension out of the diaphragm, either manually, putting your finger in your belly button and loosening up all the ligaments and musculature that connect to the belly button. That is your first wound, that is the first scar on your body, is your belly button. And it actually creates a lot of trauma and tension, especially babies who have torticollis. They experience trauma either in labor, birth, or during pregnancy, and their fascial system tightens up. So when they're born, they have colic. It can be released. There's practitioners like myself that do work on newborns and infants. That's a side story, but releasing the diaphragm through deep breathing, manual release, and focusing on just calming your nervous system through various vagus nerve stimulation techniques. So again, let's go over it. Number 1 stagnant place is under the jaw and the chin area. Number 2 is the armpit and upper chest. And number 3 is the diaphragm. So when doing your full body lymph routine, which does not have to be done every day, trust me, I don't do it. Maybe once or twice a month, I'm doing like a full body cleanse of my own lymph. Focus more on those 3 spots and you will see way more consistent results. The glowy skin, decrease in bloating, better immune system, the list goes on. Let me know if you have any questions and I'll answer them below.